Well, hello everyone. Thank you for having me here today. The music is great, by the way, just saying, but I want to start with just a simple question. So if paying claims is something we've been doing for decades, why is getting it right really, really hard? Because really paying claims is really easy. We've built systems, processes, and we process millions of them every single day as a healthcare payer. But paying them right, that's where the complexity lives. And ultimately, that's where our costs are going to be controlled. So, to level set, ask 10 people what is payment integrity, and you're likely going to get 10 different answers. But at its core, payment integrity is a set of programs, processes used to prevent, detect, and correct inaccurate payments. More importantly, it's not a single function. It's a core set of tools that are integrated and able to provide timely, accurate, and compliant oversight in claims payment. Now, one would ask, is the responsibility for providers to bill the claim correctly? Yes. Is the responsibility for payers to pay the claim correctly? Yes. And ultimately, they both should be using CMS, AMA, state and federal guidelines, as well as their contract terms. So if they're all using the same tools, why can't we pay them the same? Why isn't everybody paying them right the first time, paying them correctly? Because we get a lot of errors. As a healthcare payer, we see billions of dollars in overpayments and or underpayments that are billed inaccurately and or paid inaccurately. Now you might be asking, how is that possible? Why is it so hard? Ultimately, everybody's using the same tools. But healthcare isn't black and white, as you all know. It's all shades of gray. So let's take an example. Something as simple as an inpatient stay. Provider bills the claim, generally speaking, gets a DRG, a diagnosis-related code, and ultimately, it should be easy to pay that, right? But as the bill comes in, a coder is going to look at it one way, an RN is going to look at it another way, and a physician might see it even a third way. And then you add in severity levels, clinical nuance, client specifics, and suddenly what looked like something that could be easily billed and paid, same, everybody's happy, turns into that gray space. And ultimately, that's where the cost lies. This is where payment integrity becomes critical to every claims process. Ultimately, it needs to be embedded in the end-to-end claim lifecycle. It can use clinical review, data and analytics, network strategy, all with the same goal to pay the claim correctly. Now, payment integrity didn't always work this way, and I've been in payment integrity for 25 plus years. 15, 20 years ago, it was very reactive, very much a post-pay space, and many times we only identified the really, really egregious payers, or payants, rather. But today, it really has shifted. Over the last 5 to 8 years, you all have probably heard the term shift left, right? We're trying to go further upstream, make all of these errors be fixed on the prepay space in the front end. But it even can start before that. And that's where we found some really solid, good challenge. And ultimately, through provider education programs with payers and providers working together, aligning on billing practices, and clarifying those gray spaces, we've been able to improve our coding accuracy on the front end, so it does create a seamless billing process, an end-to-end claim lifecycle. And ultimately, it's going to reduce those inaccuracies. So overall, payment integrity works ultimately as a claim comes in, and the goal is for payers, all payers, to pay it right the first time. Aetna, as an example, has hundreds of edits that sit right at the front end of the claim lifecycle that ultimately in real time uses automation and AI to check for clinical and reimbursement alignment with the bill. We have real-time clinical data that ultimately is leveraged by MDs, RNs, and coders to make accurate decisions right up front. And that happens on thousands and thousands of claims every single day. Now, while majority of the claims are handled in that space with automation and at scale, there absolutely are still places where we want additional insight that demand a deeper focus. High dollar claims, specialty services, complex clinical cases. And in those instances, we absolutely request more information, whether it's an itemized bill or a medical record, because we want to get it right. We want to make sure that the accuracy of the billing, the documentation supports the billing, and ultimately it makes sense the way that it's being billed. When payment integrity is managed within the payment integrity or within the claims ecosystem, it can operate at scale. It gives real-time insight, end-to-end visibility, and we can take immediate action. And the impact is not theoretical, it's measurable. On average, Aetna saves $50 per member per month using its payment integrity functions. Now, there are point solutions in the market that can absolutely bring value. The only challenge is they don't have access to the contracts. They don't have access to all of the various complexities within that payer ecosystem. And so, although they can provide focused insights, the question you need to be asking when they come to you and say, I can save you $10 million more than your client today, or I can save you 20 million. What is incremental to what's already happening today? That's the question you need to be asking, because a lot of times there is edits, processes in place that you're not even necessarily aware of that are fixing the claims so that it's paid right. And those point solutions that may say they're going to bring incremental value aren't necessarily going to bring that value because it's already happening today. The real power comes when core oversight sits within the ultimate end-to-end claim lifecycle. And working together between payer and provider, that's where you can really identify and find additional opportunities. So let's go back to where we started. If paying claims is easy, then cost management isn't always about processing claims more efficiently, but it's about precision, because every inaccurate claim is going to distort your data, inflate your trend, and erode trust between payers and providers. Accurate claims help reinforce consistency, strengthen partnerships, and create financial clarity. So I'll leave you with this. The next time you evaluate performance, don't just ask how many claims did you process, how quickly did you process them, but ask how many claims did you process accurately? How many claims did you get right? When you embed payment integrity end to end, you can align policies, providers, systems. You move from a reactive to a proactive approach, and you don't just reduce errors, you can fundamentally change how costs are managed. Paying claims is easy, we've proven that, but paying them right, that's truly how you manage costs. Thank you, have a great day.